Hi, I'm Dr. Jee, and I'd like to talk to you about cataract surgery. As a surgeon, I love doing cataract surgery and achieving great outcomes for my patients. We'll work together to customize the best plan for your vision before proceeding. Let's first discuss what a cataract is. Inside your eye, just behind the colored part of the eye called the iris, sits your natural lens. The lens is clear when we're younger, allowing light to enter the eye so we can see. As we get older, our lens gradually becomes cloudy, and this is called a cataract. Now, looking through a cloudy lens can cause blurry vision and difficulty with bright light, leading to glare or halos. At some point, glasses or contact lenses cannot improve your vision, and the cloudy lens needs to be removed and replaced with a clear, permanent artificial lens implant via cataract surgery. You have several choices for your lens replacement, which we can tailor to your visual needs. We want you to feel comfortable as well as informed about the decisions you'll have to make. At the Cleveland Eye Clinic, we're proud to offer the latest technologies to our patients. If you choose the basic lens, I can help improve your vision with glasses or contacts. This lens doesn't correct for astigmatism, so after basic cataract surgery, you will need glasses for your best vision. This lens only corrects for either distance or near focus. Most patients prefer sharpest distance focus, so you can expect to wear a thin pair of glasses for distance and reading glasses for up-close vision. If you choose our driving package, I can maximize your distance vision so that you're less dependent on glasses for distance and just wear cheaters for up-close vision. With this specialized technology, I can correct your astigmatism, which affects your focus, thus giving you high-quality vision. An alternative strategy is something called monovision or blended vision, where one eye is set for clear distance and the other eye is set for near. This reduces dependence on glasses, although there still may be times where you may prefer to put on glasses, let's say for driving or for more up-close tasks. If you've had monovision before, this typically is a great option for you, but it's not for everyone. If you haven't had monovision before, it's important that we simulate it for you prior to surgery with a contact lens trial, just to make sure that you would be comfortable with it. Another great option you have is our multifocal package, where we can maximize both your distance and near vision, giving you increased range of focus and less dependence on glasses and more functional vision. While it's a great lens, it's not perfect, and there still may be times where you'll prefer to wear glasses for small print or in dim light. When it's dark or at night, you may see halos or glare around lights due to the way the lens works, but our brain does a really good job of adapting to this. The multifocal strategy is best for patients who really wish to be as independent from glasses as they possibly can be. If you have glaucoma and use eye drops to reduce your eye pressure, I can also perform a minimally invasive glaucoma procedure during your cataract surgery. This will reduce your eye pressure, preventing further damage to your vision from glaucoma, and I can potentially reduce your need for eye drops after surgery. This procedure is very quick with minimal additional risk. I can review with you if you're a good candidate for this procedure. Let's go over what you can expect during surgery. Cataract surgery is very straightforward. I'll remove your cloudy lens and replace it with a permanent clear lens implant. It only takes about 10 minutes. You can expect to spend a few hours at the surgery center and then go home to rest. You'll get checked in, the nurses will place dilating drops in your eye, and then the anesthesia team will get you ready for light sedation. Our goal is to keep you comfortable during surgery, but you will be awake so you can follow instructions. There's no need to worry, even my nervous patients do well. During surgery, you'll see a nice light show as I ask you to look toward a bright light. You'll feel some cold water washing your eye from time to time, but it shouldn't be painful. After a short recovery, you'll go home and rest. Most people have minimal pain after surgery. It's normal for the vision to be blurry for the first several days after surgery as you're healing. We ask that you avoid strenuous activity and use the shield at night for 1 week to protect the eye. I normally recommend using a drop in the eye just once a day for a month. If both eyes need surgery, we'll start with one eye first, and then we'll do the second eye a few weeks later after we confirm that your first eye is healing well. At some point, weeks, months, or years after your cataract surgery, a cloudy film will develop behind your lens implant and you may experience blurry vision. There's no need to worry if this happens because I can perform a quick and painless laser procedure to polish the lens so that you can see better. Now let's review some of the risks of cataract surgery. Cataract surgery is very successful, and risks are very rare and minor compared to most surgeries. The risk of requiring a second surgery or having a problem that would threaten the vision in the long term is less than 1%. I'll of course let you know if I see anything before surgery that will put you at a higher risk compared to any other patient. Thank you so much for taking the time to watch this video. We realize this is a lot of information to digest. So if you have any questions, please feel free to ask me. I want to make sure that we have a clear plan before surgery that we can both agree on. Thank you so much for listening.